Welcome back to the Finish Line Project. And today, the topic that I'm going to bring up is verbal and non-verbal communication. So, whenever we take up the case history of the patient, communication can be of two types. It can either be verbal communication or it can either be non-verbal communication. Now, what exactly is the difference between the two? Now, as far as verbal communication is concerned, is whatever the patient is telling you in their own language or language that obviously you and the patient, both of you understand. The main difference is that whatever is being said in words is verbal communication. For example, I'm talking to you through this video, so this is verbal communication. Whenever I use my hand gestures or any gesture through my body language, that indicates towards, something I want to convey, but I may not be able to put forward in words, is non-verbal communication. And for this, one thing that I do recommend dental surgeons or doctors is that all of them should at least try to understand the science of body language. Whenever the patient enters your clinic, a lot is this part what is said through one's body language than is said through one's verbal expression. So it is very why is this important? Because whenever you look at a patient's body language, you may be able to tell whether that patient is genuinely willing for the treatment or if he is somehow coming under the influence of another person to get that treatment done. A very basic example of the same would be, for example, a patient has come for some kind of a cosmetic makeover. Now, in order to determine whether this is the desire of the patient himself or it's the desire of people around him, a lot can be gauged through his body language. In case the patient is confidently demanding the treatment that these are my teeth and I want them to be corrected in this certain way, that would put some sort of confidence that at least the patient is sure of himself and is sure of the fact that he wants to get the treatment done. Now, how to make out whether the patient is, someone which is compelling the patient to get the treatment done. You will notice a certain amount of disinterest in the way the patient talks. The patient may not pay attention to the details that you're trying to give out to them. For example, I may be trying to explain with the patient that this is the way I'm going to design your smile, this is what I'm going to do, this is how I'm going to select your shade, and these are what will be the end result. In case the patient, you certainly are able to judge that the patient is not paying attention to what you're trying to tell them, you can get a fair enough idea that probably it is not the patient is the primary person who wants to get the treatment done. Somebody has either compelled them or told them that they don't look good enough and that is why they come for the treatment. In all such cases, your duty is to at least, try and ask the patient that is this your own wish that you want to get this treatment done or is it somebody else's wish? Now, in case it's somebody else's wish that they've found for this particular treatment, the best thing to do is to try and convince the patient and use your own judgment to see whether the patient actually needs that treatment or not. In case the patient does not actually need that treatment, in case there is no acute requirement or any kind of requirement for that sort of a treatment, you can simply tell the patient to not get that treatment done. And you can assure them that however they're looking right now, they're looking absolutely fine. Now, this was the idea of a smile slide. Alright, this is one example. There can be multiple examples throughout the medical and dental spectrum. Being a prosthodontist, most of the patients who approach me for replacement of teeth. Amongst them, a lot of patients are elderly and they desire complete dentures. It is up to me to gauge whether that patient actually wants to get those dentures done or is being compared by people at home or people around them to get those dentures done. So, although complete dentures are absolutely essential for every patient, but in case you have a patient who is indifferent, it is up to the dental surgeon to gauge this out in the first place. Why? Because only then will we be able to modify their attitude so that they can accept this process. What is the importance of this? You would say anyway, if I give them the dentures, they are going to start eating, so they are going to accept it. This is not how it happens. The acceptance first comes in the mind of the patient and only then will they accept that thing physically. So it is up to you to gauge that in case they are being forced, you have to tell them that, the person who's probably forcing you to get this complete dentures done has some sense of this thing that they know that these dentures are going to benefit you in the future. That person is saying this for your own benefit. You have to convince the patient and prepare them mentally that they actually do require these dentures. Only then will they accept your prosthesis. Otherwise, what will happen is that we will give them the denture. They already detest that somebody is sending them forcibly to the clinic. Except they detest that. What is going to happen next as a result of it is that they will also detest your prosthesis. So they will associate your prosthesis mentally somewhere with that person who is forcing them. So you have to be that moderator will at least mold or convince your patients that this is something that is much required. Always try your best to upskill yourself in the field of non-verbal communication so that it engages the needs of the patient. Thank you so much for paying attention. And I'm signing off today, and we'll come back to you with more such content.